they are likely to end up having heart attacks. And evidence have shown that persons who have gum disease, when they've gone and checked everything, that the same bacteria that's in the gums, they found them in their heart. Another thing that's related, especially to persons of color, is diabetes, because unfortunately it affects us at a higher percentage than the other ethnicity. And you find that a lot of times when they come to the dentist, is when we look in their mouth, we realize that there's something else happening. And when we send them to the doctor, we realize that they have rampant, their diabetes is out of control, and they have to be seen then by their physician. So another thing to point out to you is that most persons do not actually have pain in their mouth all the time. It's actually 35% of us who actually have pain. So most persons will come to the office and say, oh, I'll show them something on their x-ray, and they say, oh, I didn't feel any pain. But that's most of us. Most of us don't feel pain, and so that's why it's good to come in every 6 months to have a regular checkup in your mouth to ensure that it doesn't get to the point of pain. Or I will tell them that their tooth is broken and they say it's not hurting them, so because it's not hurting them, they don't come back. So the main issues that we have in our mouth is, of course, related to the most obvious one is a hole in your tooth. That's a cavity. That's formed because all the nice food that you guys can cook, and I know a lot of you ladies and gentlemen can cook very well, but when you brush your teeth, you leave a little behind. And the bacteria that we have naturally in our mouth, you cannot get rid of that bacteria in spite of what Colgate says in their ad. It's there to stay. So the bacteria eats the food, produces an acid, and the acid eats away at the tooth and creates the hole. And you have different layers of your teeth. And as it will start off, you feel a little thing, and then you ignore it. But as the cavity gets bigger and bigger, it goes towards the nerve, and then you start having pain. But before you get to that point, the tooth could break on you. So that's it. That's what everybody remember. The next thing is gum disease. Everybody think that if you have a pain in your mouth, it has to be your tooth. Remember, all of that pink stuff that surrounds your tooth is also very important. That's what actually protects the teeth. And when that gets damaged, that's gum disease, then you can also lose your teeth that way. The bone that holds the teeth in place, that same acid that I mentioned, can eat away at the bone and you lose your teeth. So the whole idea for you to keep in your appointments every 6 months with the dentist, the whole goal is to try and keep the teeth for the rest of your life. Because whatever we try to fill in will never be as good as the thing that the dear Lord gave you when you came in with. So you need to try and maintain what he gave you with. I don't want to get religious, but remember you must honor your body, honor your teeth as part of your body by coming to the dentist as regularly as you could, okay? So, one last thing now that I found, and all of us dentists have found since COVID, and we coined a term called COVID mouth, is grinding of the teeth. We all know how stressful COVID was. And what we found happening is that first 6 or so months when we had shut down, persons were so under so much stress that they were grinding their teeth, and they were actually splitting their teeth in two. So when I was off, when we were shut down and we could only see emergency, most of my emergency during those 4 months were persons who had grind their teeth in two. And so now what we've found is that post-COVID, although we all think that COVID is gone, we find that it's still lingering and is affecting the tooth structure still. They're trying to do tests to see what exactly it is, because that's a different virus than what we are used to. So the test is still out. So what you find happening now, and it's just life now is very stressful, so persons are grinding their teeth. So they'll come in and they'll say their teeth hurt, and it's because they've put so much pressure on the tooth that the tooth has become inflamed. Inflamed means, when you get a cut on your hand and before you put that Band-Aid on, how it hurt a little bit, that's what we mean. So we find now that it's the stress of life that's causing persons to grind their teeth. But it looks like at Lighthouse that you have a nice environment here, family and friends, to worship on Saturday and during the week, so that Maybe your stress level is not as high as the others that I see. I'm just saying. And for that reason, they're not grinding their teeth as much. So that's what we found in the last 6 months. No, it's not new, but it's because of the stress level. Because here's the scenario: you work. Some of you work multiple jobs. You have kids. You have grandkids. When you go home and you go to bed, you don't decompress. That's the term I want to use. So you take a lot of that stress to bed with you, and when you take it to bed with you, that's when you put in the stress and grinding and breaking the teeth. So it's not that it was new. It's just that the stress level, since before COVID and since COVID, has gotten more extreme. So that's what it is. Oh, one last thing before I throw it out for general info questions. Another thing that we have that persons don't realize, and especially now with the weather that we have the changing, you can develop sinus issues. Yes, you can have sinus issues even if you never had it before. And what you find happening is those persons who have sinus issues, the sinuses are right up here where I'm pointing to. And when those become inflamed, they start to push down on the top teeth. So you actually think you have a toothache, but you don't. It's your sinuses that have become inflamed because of the weather. And remember, you know how it is, the trees, the pollen, all of that will start off the reaction. If you have a toothache doesn't cure itself in a few weeks, and usually the sinus issues does. So that is something that I've found that I have to educate my patients that everything in the pain that you have in your mouth is not always related to the tooth, and in this case, the sinus issues are our primary concern for a lot of patients that I've seen. And the good thing is that summer is coming, and even with the rain, because it's nice and hot, your sinus issues go away. But the bad news is when it gets cooler, that's when you have the issues coming around again. So those are just some factors that most persons just associate your teeth with your teeth and gums, but there are other things that you might not have known. So grinding your teeth, and by the way, you will not know you're grinding your teeth. I know that might be the next question. And I'll give you a funny anecdote. The women know when the men are grinding their teeth, but the men don't know when their wife are grinding their teeth. Women, just because, no offense, men, we're just more observant, no offense. You go into your bed, but women, they're up and down thinking about everything else, and they can hear you grinding your teeth. You won't hear yourself grinding your teeth. So I usually get that response from my patients. Oh, but I don't know I'm grinding my teeth. You won't know. Somebody else has to tell you that you're grinding your teeth, besides me. And I find that when I check my pool, the men, I can guarantee you, I send the men home and say, ask your wife, oh yeah, you grind his teeth. I send the women home and the husband say, oh yeah, you grind your teeth? That's the response. Yes, so but that's part of the issue. So grinding your teeth and sinuses are two factors that we are finding now that persons are coming into me to see. So the response, sometimes if you grind your teeth too much, the problem with that is you can break the teeth because these muscles that you have here are very strong. And if you put too much pressure on those poor teeth, they can break, which is what we found when we were on lockdown and we only came in for emergency. Most of us that came in for emergency dentists, that's what we were treating, persons who had broken teeth. And it wasn't broken because they were doing anything. It was just so much stress that they were just trying to absorb and try and deal with the total uprooting and the anxiety associated with COVID. Okay? So as I said, the whole idea is to come to the dentist for regular checkup every 6 months. Some persons have to come in every 4 months, depending on how their teeth are. But it's always good to come to the dentist every 6 months so you can check your teeth and all that good stuff. Now, Mr. Scott had asked me to speak about insurance, so I'm going to cover that and then I'll throw the floor for general questions. Okay, so insurance is just an assistance to help you with your teeth. It's different from medical insurance. When you go to the doctor, whether you have Medicare or you have insurance or you have HMO, you might pay a small copay, you might not. And the bulk of it now, they'll bill you. Dental insurance is not like that. And the dental industry, insurance industry has changed quite significantly, again, since COVID. They are paying out less, they're not honoring a lot of what they promise, and they are more inclined to drop the dental portion from your benefits. They'll keep the medical, but the dental will be thrown to the wayside, basically. So always remember that dental insurance is an assistance. It will never pay 100% of what you need. So when you go to the dentist and they show you what you need to have done, the response is not to say to wait for what the insurance pay, because remember, to be honest, insurance is a business. Yes, you're there to pay insurance, but ultimately, their primary thing, don't care what they say, is to their shareholders. So they will never be putting your best interest at heart. If you find you go to a dentist, and like many professionals, you have some professions that they're not too honest, and you have some that they are. And you have your own intuition. If you go to a dentist and you find out, okay, this don't sound right, then there are millions out there, thousands rather, that you can go and get a second opinion. But you shouldn't rely on just what the insurance pays, because here's how insurance pays. Insurance divides certain things into categories. So you have your regular cleaning, you have x-rays, you have certain procedures that you can do that they'll pay for, but they pay a percentage. So they'll pay 40% or 60%. So you'll go and think that, okay, I can have this amount of money in my insurance and they'll cover it, but that's not how it works. Insurance, as again, is just an assistance. You still have to pay out of pocket for a fair portion of what you have to cover. Okay? So I'm going to ask if you have any questions, I will cover them now. And yes, ma'am, in the purple. Yes, she did.
Help me to get the mic to you. Well, while I have the mic, I do have a question,
yes, ma'am.
Dr. Nelson. I was told this years ago by my dentist that I should use a special brush to brush my tongue and not use my toothbrush. Can you explain that?
It's actually not a special, oops, I don't want to break it. It's not a special brush per se. What we don't want you to do is be in there brushing it as hard as you brush your teeth. Because remember, your tongue is what makes all of your food taste good. So you really don't have to be in there brushing your teeth. There's something, it's not a toothbrush per se, it's something called a tongue scraper. It looks kind of like a spoon. And so what you do is you actually just put it from the back of the tongue, you move it to the tip, and you do the left, middle, and right, and that's it. So you don't want to be in there scrubbing the tongue, because if you do, you will take away the taste buds, yeah, and your food will taste different. So, no, you don't need a special brush. You just need to be able to remove the bacteria that is settling on the tongue. See the young lady in purple top?
Where can you get this tongue scraper
It is
from?
it is in the dental aisle. It's called a tongue scraper. They don't come up with a very fancy name. But it looks like, if you can imagine what the spoon looks like, it actually looks like the spoon. So the top of it is shaped like that, and you just put it in the back of your throat, back of the tongue rather. You do the left, you do the middle, and you do the right.
And thank you. One more point.
Yes, ma'am.
I love nuts, as most Jamaicans do.
Yes.
I love my peanuts, my cashews. And the dentist told me recently that as you chew on the nuts, bits of the nuts are getting stuck between my gum and my tooth. So I cannot chew my nuts anymore. I have to make them into a smoothie, which just takes away the taste of the nuts. I'm sorry.
Okay, so this is where we go off. All right. If you have... I'm trying to figure out why he or she would say that, because I don't agree with that, because I love nuts too. And nuts is a very high level of protein and fat that you should have in your diet.
Yes.
The only correction I have with my patients is that the very large nuts, those macadamia nuts and the other ones, those I say you must break up before you eat them. Because for you to bite down on that, you have to put a certain amount of pressure on it. For the nuts, most of us don't chew the nuts to the point where it is going to go down to the gum level and go into the gums. Because we love cashew and we love peanut, we drink 1 or 2 times and we're going for another handful, and we're going for another handful. So you will be more inclined to get something called diverticulitis, which is where you don't chew the nuts enough, which we're all guilty of that, And when you don't chew the nuts enough, it will go into your intestine and actually form in the pocket of your intestine, not the pocket of your gums. That you have to worry about. Because then you have, some patients will say, oh, when I eat nuts, I have that intense pain. It's not, and you're not allergic to nuts. It's the fact that our intestine looks like for us to live in Jamaica, it looks like a very hilly, rounded road in Jamaica. And as the nuts have to go around it, sometimes they don't go quite around it and come through the intestine. It kind of lodge in those little pockets. And you can get something called diverticulitis. And that is just something that, then they give you something to ease it out. So then they'll tell you to minimize your nut intake. No, the flip side of it is too much of one thing is not good for the other. So I had a patient who cracked his teeth recently, and I asked him how. If you're eating, as he said, a can of Planters peanuts every day, you will break your teeth. So it is to modify everything in moderation. So no, I don't agree with that, the nuts part. Now, some persons, if you have indentures, you will find it will be harder for you to chew the nut. Harder, but not impossible. So what you do is you just break up the nuts a little, not mash it up, Miss Perlin, in the smoothie, because then it don't taste like nuts anymore. But just kind of, you have these things called coffee grinder, that you put the nut in and you do one, and it's very cheap at Walmart, 1 pulse, and it is broken down enough. That is how my husband is eating his nuts now. So 1 pulse, it break it down enough, and you can still have it. So no, some people have very involved bridge work, so you can't eat the nuts every day. You have to do it. Or if you're having it, you can't have, as my patient had, a whole tin of cashew nuts for 3 months. That's not advisable. But I wouldn't rule out the nuts because it gets down into your gums. And remember, if it gets down into your gums, you can brush and floss it away. So, and it's never ever going to be that big that it's going to get stuck in your gums. If it gets stuck in your gums, Ms. Burrell, it means that your gums have become so inflamed, which is something different, not from eating the gums, where it has moved away from the tooth, and so the nuts can slide between the teeth and the gums. But that means that something is first of all, something's wrong with your gums. And there's a big space between the gums and the teeth. So please eat your nuts.
Thank you. Thank you. Okay, so thank you. So please raise your hand.
This lady in purple had her hand up first, I think. No,
my question is insurance purposes. What's the difference between the HMO and the PPO?
Okay.
And what's the difference? What benefits do you get from each?
Okay. So the HMO, thank you, ma'am. You know, that was one of the questions I have on my paper and didn't answer. So thank you for bringing that up. So the HMO is, you have to go to an assigned dentist. And with the HMO, the idea, they have a special contract with the insurance company where you have to cover certain things free in quotation marks, but no offense, nothing is free in this world. So when you go to the dentist, they're going to, and it might sound horrible, but they're going to have to find a way to pay the hygienist or pay the assistant or pay the staff to do what they're doing there. So you find that your services that you will pay less out of your pocket, out of your check every 2 weeks. The premium or whatever you pay will be a lot less. But the benefits that you get is a lot less because it is limited to what you can have, one. And it's also limited to the access that you have with the dentist because most dentists, if they're accepting insurance, all of them will accept the PPO. Now, this is where the PPO has a sub-breakdown. You can be in network with the PPO and you can be out of network with the PPO. The HMO has to be an in-network. You actually go to an assigned dentist. When you look on your card, you see a dentist's name. You can only go to him. The general dentist that accepts PPO, if you have a PPO insurance, you can go anywhere. And if you need to go to a specialist, like our oral surgeon, he's the one that have to take out those very difficult teeth that the general dentist can't take out. If you need a root canal, that's the teeth when the tooth have too much, a bigger hole, and it's in the nerve, and we're trying to keep the teeth. So those specialists will accept your PPO. None of them will accept the HMO. And the difference is because of the benefit that both you and the dentist can get. The dentist gets very little reimbursement, so they're not going to accept it. Very few will take it. And if they do take it, they are going to limit the service that you can get, just like what the insurance limits. The PPO is you will pay a little bit more out of your pocket with your premium, but you'll have a wider range of dentists that will accept it. And what the insurance company will do, they'll do an extra trick to you and tell you, only go to the in-network dentist because you're going to pay more if you go to an out-of-network dentist. That's not true. If you have this amount of benefits, the out-of-network dentist will honor it and say, you will pay this portion. But the in-network dentist, a lot of times, you will still get the same benefits and you won't pay any extra. But like everything, even with the HMO, you still have to pay a copay. But the difference is, HMO, you have to go to that assigned dentist. And if you don't like that dentist, you have one option. They give you an option of two, because they give you the dentist that's close to where you live. So if you lived up by university, they would give you a dentist in a 5-mile radius that will take your insurance. And that's the difference. The PPO give you more flexibility. You can go to any dentist that you want, and you can go to an in-network and out-of-network dentist, and you still get the benefits. And that's the most important. There's a new one that they have now called a PPD, which is a variation of the PPO, but it has the same benefits and stuff. Yes, sir.
And there's another new one, it's called EPO.
That one is also, it's just criminal. That don't have any point, it don't make sense. It's just criminal. They don't pay out anything, sir. And when you call it insurance companies, the benefits that they give you is not enough. Let me give you 2 anecdotal things that happen with insurance now, especially if you work and you get your insurance through your job. Here's what. Every year you have to sign up and renew your thing. Please look on your sheet, because the first thing at the top that your employer is offering you is the HMO, because that's the cheapest. Read a little further down to get to the PPO, if they offer it. That's the first thing. If you are getting your insurance on the marketplace, the insurance agent is going to try and sell you something. You will find 95% of those insurances, you have a waiting period of a year. So you have to pay for a year before you get anything. And when I say anything, you have a toothache, the insurance company is telling you, wait a year, and then you can come to them. That is what 90% of them are like. So the EPO is in that group, sir, that's like that. The ones that have that waiting period, and the ones that are not, they're not being very beneficial to you. Another second anecdotal one is, this patient came into the office and said, her insurance covers 100% of everything. And yes, it did. But this lady was 65. And the insurance covers 100% for people 22 and younger. And now you know, whenever you go to the doctor's office, the first thing you ask you for when you're giving it, what is your date of birth? So it means that the insurance agent knew her date of birth, but sold her an insurance where her benefit, this lady could not divide that maths enough to get the benefits, because she's 65, the benefits start at 22. So what you find now is that the insurance company is not they're just doing whatever they want. So that EPO, sir, is not a beneficial one for you to have. It's just another one that they've attached the E to with the illusion that you're getting benefits. But it's really a HMO, but they attach the EPPO to say that you have that.
So my question to you then is that there's orthodontist and there's a periodontist. Which of them are you? And what's the difference?
If you're a periodontist?
Yes.
Yeah. So I'm a general dentist. So when I do everything that is general. I do some things. Let me rephrase that. So the general dentist does general stuff. But when it gets to a certain level of difficulty, I kind of refer you out. And you have different general dentists that have different level of expertise. So I'll give you an example. I shared the office now recently with another dentist that does and loves to do a lot of wisdom tooth extraction. I don't like to do that. I do the simple ones. So whenever I get a little, and then I said, okay, Dr. Marfan, this is your responsibility, and he takes them over. The periodontist deals primarily with your gums. So they also place implants. Remember, implants are structures that go into the bone to replace missing teeth. So they will do the implant. I do implants, but sometimes if the implant doesn't have enough bone to hold implant in, then you might have to go to a specialist. So the periodontist is a specialist that deals with gum disease, bone, and everything like that. They sometimes, if you say you want an implant in the top and you have a missing tooth, they have to do different procedures and surgery to prepare that site. So the periodontist only deals with everything gum-related and bone-related. Now, they have an overlap with the oral surgeon. Oral surgeon is a person who do the major surgery, extract the teeth. If you have a lot of bony protrusion in your mouth, they do that kind of surgery. So that's the difference between the periodontist and the general dentist. The periodontist is a specialist that deals with gum disease. So if you went to your general dentist and they said, you need to see the periodontist, it means then that you have gum disease that cannot be just fixed by just cleaning up underneath the gums. You have to have surgery. So they've sent you on to the periodontist, who will try and do a different, more involved procedure. They might put bone there to support the teeth, but if it's loose, and they might do different procedures. But that's something that they do. That's extra.
Where's your office?
My office is 2 miles west of here, just a block west of 441 on Broward. I'm on Broward. Right beside that, near to that, where CareMax is, no, I think, is it CareMax? And near to the bridal shop. Oh, 4330, I have a few cars here. 4330 West Broad Boulevard, Suite M as in Mary, Plantation, Florida.
I just wanted to say that I referred a lot of people to dentists. So I just want to gather some information.
That's right. Thank you, sir.
Yeah.
I'm going to leave some cards with Merles and Mr. Scott. So if you guys need to agree. Yes, sir.
Just one question, Dr. Nelson.
Yes, Mr. Scott.
Do you have your own internal, say, insurances to help new patients, or
we have a program that we've partnered with a company called Cherry, and so they will assist you. They do it. So it's internal, but it's done by an external body that works with us, and they will help to guide you through how you can get the financing for your treatment, depending on what you need to have done. So we have that, and then we have something that's external, totally external, called Care Credit. Care Credit is something that you would apply for, and if you get approved, they put the money up for your service. We, the dentist, pay a fee to them, and then you pay them based on your budget. So you have 12 months, or you have 18 months, you have up to 5 years to pay off your portion. And you can do it with interest or without interest. So we offer those to patients who don't have any insurance. Because that's another thing we hear. I'm not going to the dentist because I don't have insurance. Right. And the unfortunate thing is you wait, the problem gets worse, and then when you come, the insurance, and you give us the insurance, pardon the pun, but they want to beat my poor front desk lady to death because they don't have an insurance that they thought they had, and they still have to come out of pocket. So the bottom line, why we got all of these Care Credit and Cherry, is to tell you, don't wait for you to get insurance to get the help, because whatever dental problem you have in your mouth is not waiting for you to get insurance. So all of these offices offer some form of financing. Some of them have in-house financing, and we have that too, where we give you pay something every month, and that when you need to have the cleaning done, you just come in and get your cleaning, because you're paying, just like how you do an insurance, you're paying a small amount of money every month. So we call that our own in-house financing that we offer. And based on that, if you need certain procedures, you get a percentage off because you're in this club.
I have a burning question.
Okay, then.
Or I should state a case. Why does the dentist want to take out everybody's wisdom tooth? One sec. My son, when his own was coming out, they were telling me crossways, sideways, everything. I said to my son, leave it alone. And I told him I'm not going to take it out.
How old was he?
Like 18 years old
Okay.
when it normally comes out. And it came out and it was perfect. For me, I have my 32. Every single time I go to the dentist, I must take them out. I say, it's not a problem. I don't have a problem. I don't have any cavity. I've never had a filling.
Hey, you've reached
I'm
Christina.
quite fine. My mother
Lauren.
did a good job. So why you, it's like they hate to see it. But my thing is like it's a money thing. Everybody must take out their wisdom tooth.
Well, if it's a money thing, we wouldn't be getting the money thing because we're sending it to the oral surgeon. So, so we would not be getting the money thing. But what happens is, a lot of times when your son is 18, your son was the minority in terms of it correcting itself. So the general dentist, or I'm assuming he went to general dentist initially, would look on it and say, okay, the way all this teeth is positioned, and the strong possibility has that this tooth is going to go a different direction. And that is based on the facts that we have. Most of the time when the tooth is turned anyway, it will turn that way. It will continue to turn that way. And we don't want the other teeth to get affected. So we're trying to get ahead to be more proactive. Because if the tooth is turned sideways and touching the tooth in front of it and you can't clean it, then that tooth can get affected. That's one. We're looking at it in the future. If you take it out early enough before the bone gets dense, it will be easier for you to take out and you won't have the pain. Because every time a patient comes in and they say, you have to take out your wisdom teeth, they go home and all of their family and friends say, oh, your face is going to look like a chipmunk, you're going to swell up, you're going to have a lot of pain. But a lot of times that doesn't happen because we manage it. So in your son's case, your son was lucky, or the Lord was on his side. Let's go with the Lord on his side, where it didn't go the way that it should go. And normally, that's what happens. So it's not a money-making thing per se to the dentist. We're just looking on it and see, now your teeth most likely is turned in some weird way. And the problem with the wisdom teeth is half of it is in the mouth and half of it is underneath the gums. Then over time, and teeth problem is like a slow drip. The bacteria, because you can't get to that part of the tooth that's underneath the gums. So the bacteria will get underneath there and eat away at the tooth. And then somewhere down the line, you have the pain, and then we have to go in there and take it out. Now, remember, if you come to us with pain, and we take out your teeth, you're going to have some pain afterwards, plus the pain that you came in with. So it's not a money-making thing. It is what we see as a possibility for problems in the future. And that money thing, most of us, if we say you must take out your teeth, we're sending it to the oral surgeon. So the oral surgeon will be giving the money to, not us.
But in addition to that, for the wisdom teeth, our tooth when it's coming up, they always hurt. I mean, there's no escaping it.
You mean the wisdom teeth coming up will hurt?
When it's coming up, there's always a little pain or discomfort, I should say. But most times, because I've known it happen to several individuals, and they would say, oh, I'm going to take my child to the dentist to get it come out. And I'm like, it happens to everybody. Just give it some time.
Well, first of all, it don't happen to everybody.
The discomfort?
It doesn't happen, no, because I got my wisdom teeth and I didn't even know I got my wisdom teeth until that. So most persons don't know they have their wisdom teeth until I look in their mouth and say, oh, you have all four. And I said, yeah, when did that come in? So no, it doesn't happen all the time. But what happens is the gum tissue on the bottom of our gum mouth is harder than the top. So if you go to the oral surgeon, they have to take out a tooth on the top. In no time at all, poof, it comes out. But the bottom, you see this jaw, that is where we have our thick jawbone. The angular jawbone of this gentleman and the gentleman in the back and Mr. Scott. So when they have to push on that teeth to go out, there is some resistance to it. So what happens is when the tooth is coming out, it's like when your kids were teething and the teeth was coming out and it hurt the gums, and you get the oral gel or you get the old-fashioned thing. I don't know why my grandmother decided to rub alcohol on my gums, but we were in the country and that's what she decided to do. So whatever method you decide to use, it's just the pressure of the tooth coming out on that hard part of the gums. But if the teeth, when it comes out and it stops. But if you find that it comes out and the ache is still there, it comes, it goes, it comes, it goes, it comes, it goes. It is just a sign to take them out. No, you don't have to take out, no. Not all your wisdom teeth have to come out. If your wisdom teeth is up, and it is functioning,
Right.
we don't let you take out your wisdom
Okay.
teeth because you don't need to. But if it has the potential to give problem to the adjacent teeth, then we want to take it out.
Okay.
And usually, well, the funny thing is, because of how kids are developing a lot quicker, so you find that kids are actually getting their wisdom teeth at 15, which 10 years ago when I started, more than 10 years ago, I didn't find that happening. So you find that kids are getting they usually get their 6-year molar at 6, now they're getting at 4.5, they get their front teeth now at 5, when they used to get it at 7. So we're just looking at the potential for error. Now, I'm glad your son didn't have to take it out, but he was just one of the fortunate ones.
Okay.
Thanks.
Yes, sir.
On the matter of braces, is there a cutoff age, or what would trump a prescription to put braces in?
There is no age anymore, as I tell my older patients, because I promise I won't break your podium. You mean the start age or the end age? Start? What age do you start at? End? There's really no end age. It is just harder to move somebody's teeth that's older because the bone gets dense. They did a study 30-ish, 25-ish, 30 years ago where they found that at the age of 27, 28, the thickness of the bone increased exponentially. So if you're in that borderline, it gets very, very hard at that time. So you will find that when you were younger, you took out teeth before you should have taken out teeth. But remember, you were given 32 teeth, not to exchange it, but you have to have the 32 teeth. So when you remove the teeth younger, when you get to in your 40s and your 50s, your teeth start to shift certain ways, and then the way you bite, your teeth actually start to hurt. Or if you bite in a certain way, they start to get loose. So in order to correct that, we have to send you to the orthodontist to straighten and put the teeth back where they should be. So it's not for aesthetics at that time, it's more for function. We're trying to save the teeth. Like I have a patient last patient I saw is 40, and because he's taken out quite a few teeth, his front teeth are now spreading like this. So we have to actually send him to the orthodontist to try and move them back together. And actually sometimes when you move the teeth, in the procedure of moving the teeth, it actually builds up bone around it. So that's why the cutoff age is whenever. So, sorry. But nowadays they have this thing called, everybody knows Invisalign because it's a brand, but it's called an aligner, where more adults want to wear that because they say, I don't want to look like a teenager with metal in my mouth. So you can get the aligners, and the aligners are something transparent. Nobody will notice it until they're this close to you. I use my sister as the example. She hates when I do this, but so be it. That's what you have sisters for. She's a middle school teacher. You know how kids are in middle school. And she had on the braces. She had on clear braces, which is different from aligners. These are brackets that are almost the color of your teeth. And it's at the end of the year, they say, oh, Miss Pinnock, you have something on your teeth. They didn't notice it. And you know how middle school kids can get into your business. So if you need to have braces done, don't look on your age, because they're trying to position your teeth, not for cuteness and aesthetics, but we're trying to put your teeth back to where they should be. Because they've shifted, because years ago, you just took out the teeth because you took out the teeth, and you didn't fill that teeth space back in. That's the problem.
So would you say it's primarily for function as opposed to aesthetics, that the decision to put braces or not to put braces in is
When
made?
you get to a certain age, it is. Now, we are in a world now where aesthetics is primary. Everybody wants to look like the person in Hollywood, even if they want the Hollywood smile. So some of them want us to move their teeth because they don't like the gap that they have. Now, that's different. The gap that you have is the gap that you came into this world with. So that is something that you're actually going against what comes in. You want to put the teeth back. You want to make your teeth don't have any space. You want to make it look. And nothing wrong with that. If you want a brighter smile, that's one way of doing it. And that would be the aesthetic parts of it. But as I said, when you get into your 40s and your 50s and 60s, A lot of times at that time, it is more a function than anything. But you do have a wide percentage of my patients who I send out to the orthodontist who don't like the space that's in their teeth, or their teeth are crowded, meaning we call it, they overlap a lot, and they don't want that. So then when they straighten the teeth, they'll actually achieve both aesthetics and function. Because if the teeth overlap too much, sir, then you can't chew your food the way you should chew.
Are there any long-term or short-term negative effect upon teeth whitening? And also, what advice would you give to a young person who want to pursue dentistry?
The last one is going to be a harder answer. But the first one, okay, so whitening your teeth, you have different ways of whitening your teeth. You can do the simple method of just brushing your teeth. Some of these whitening toothpaste. And it works over a period of time. It's just slower. The only thing with the whitening of the teeth is just like everything with moderation. You cannot whiten your teeth forever. You can only whiten your teeth over a certain period of time. So I don't do the whitening in the office anymore. You do have offices that do that. But my office is small and I can't use up the time just to whiten your teeth. So we give you the tray and you can take it home. And you have the flexibility. You're reading to your kids, you're cooking, just watching TV, talking on the phone. You can do that at home. And we usually space it out and let you whiten your teeth in 2 weeks. And then after that, we give you a maintenance whitening. You can't whiten your teeth forever because, as you said, if you do it past continuously doing it every 2 weeks, every other day, because that's what we give you. When you come in initially and we're giving you the trays, you're doing it every other day for about 2 weeks. But you can't do it every other day for 3 months and 4 months because it will damage the tooth structure. Because this tooth structure that you have, that initial tooth structure, is called enamel. That enamel is like those big guys on the football field. They are there to protect your teeth. If you take away that protection, then all bets are off. Your tooth is going to be more sensitive. When you eat certain food, we all love our curry in here, I'm sure, then your teeth may look a lot yellower than it should be, than the other person. So you'll be damaging your teeth if you do it more often. In terms of doing dentistry, it is a profession that allows you to help persons. Like, it gives me opportunity to come here and talk to this group of persons. So you have that, and you can educate persons. And it is something where you have the flexibility, depends on what avenue you're going into. It is difficult to get into, like anything, because you have to do 4 years of college and work, and then, do an exam, and then you do 4 years of dental school. So I would tell them that it is a profession that is always growing, and it allows you the flexibility of teaching, of helping others, and it's still a noble profession that you should go into. The downside is whoever going into it does know that they have to deal with insurance, and that is something that when I started in 2008, I didn't have that issue. But everything have good and bad, right? So, but it's still a noble profession that you can go into. And honestly, there's not a lot of us persons of color doing it, and worse, female color doing it. So if you know any young girls who want to do it, please let them go in it, because we need more representation, a lot, across the board. It is still no offense, men, it's still a very patriarchal profession, but it has a flexibility of, like, no, I can be here, I can then go home to my family. So it gives you that flexibility to make time for your family, because you don't have that, like a doctor where you have that on-call kind of thing. You can manage your time a lot better like this. And then you can also go on and specialize. A lot of persons, you have pediatric dentists where a lot of the kids, you can see kids, and that's a special treat for those dentists. They have a heart of gold. Yes, sir.
My question, good afternoon.
Good afternoon.
My question to you is, like, with my kids, when they were small growing up, it's like the teeth tend to, I don't know if back in Jamaica they call it double row teeth. where you have like a teeth pushing out to the front or probably inside. What caused that?
That's because so when you lose your baby teeth, the only teeth that, you see like the 6-year molars and 12-year molars, those come up, they just come up. They don't have a baby partner to push them out. But remember, your teeth are supposed to leave at a certain time. It's like some guests that you hope will leave, that they're about a few days and they're still lingering on and you want to kind of slide them out, kind of that circumstances. So if the baby teeth is there too long, the adult teeth couldn't care less. It is coming in because it's supposed to come in. So when you get that double row, you find that the adult teeth are the ones towards the tongue or on the inside and just waiting because the baby teeth, whatever it is, the baby teeth didn't go fast enough. Because the whole idea, it's supposed to come up from the bottom and push the adult teeth out and then come in that space. But some kids, they actually come in from the inside as opposed to the top. But the adult teeth is still a fighter. What it will do is, with your tongue, it will push the baby teeth. So those baby teeth will fall forward and fall out. So you find that parents will say, oh, they have too much teeth in their mouth. And we say, just wait it out. It will happen. It takes a little longer than the person who had their teeth pushed up from the bottom, because that's how your teeth are supposed to come out. The baby teeth is there and the adult teeth is underneath. It's supposed to push it out of place and it takes its space. And that's how you end up with braces. The baby teeth didn't move where it should go. And as far as the adult teeth is concerned, I'm coming in. I don't care if you are there. I'm finding somewhere to come in. So it's going to come in to the cheek side, it's going to come in on the inside, but it is coming in. So then if you don't correct that early enough, then you will definitely need braces, as the gentleman was asking over there earlier. But another thing that parents find the difference is, remember, baby teeth another name for baby teeth is milk teeth. It's white and our teeth are not white. So the first thing that parents usually find is that, oh, my kid's teeth look yellow. That's how it's supposed to look, unfortunately. So enjoy your baby teeth, your kids' baby teeth when they're white, because eventually it's going to go from white to yellow in no time at all. Because that's how the adult teeth are. Yes, sir.
I have a two-part question.
Okay.
For me, one of the reasons why I go to a male dentist is because the last one I went to.
Last male dentist?
The dentist. He's there fighting. Then after half an hour, he took a break. So I thought the teeth was gone. And then he come back, and this guy's probably 40, I would say. And I'm saying, man, what if this was a lady, how strong she would be to be pulling all this teeth? Because this guy, he's supposed to be, quote unquote, supposed to be strong. Than you know, so, and he's in my mouth so long, I'm like, my gosh, it's a good thing it wasn't a lady, because she wouldn't be that strong enough. Because this guy's here fighting, and he's like, he almost want to climb in the chair and do all of this acrobatic. But
did he eventually get it out?
Yeah, he took it out. But what I'm saying is, that's why I'm scared to go to a lady dentist, because I don't know if they're strong enough to pull out the teeth. No offense, sir. You are not. That's a question that I get a lot of times. No, the difference is that gentleman, you could have gone to another male dentist who could have taken it out in the 10 minutes. So it is more, that gentleman, no, it's not a woman. That was more a matter of not being, thank you, ma'am, not the expertise you have to take it out efficiently. So we do have, I'm not lying, we do have the disability, not the disability, but we have the thing of, we're weaker than you guys. But we use other methods to take out the teeth, because you have female oral surgeons. That's all they do, they take out teeth. And they do it just as efficiently as their male counterpart. But we have to modify how we take out the teeth. So like yesterday, I had to take out a gentleman's teeth. In order for me to push on this teeth, I realized that I'm pushing on this teeth, and I'm like, listen, this man is going to take out all of my engine for the rest of the teeth. So I had to cut a little bit of bone around the tooth. And when I do that, it popped out. Now, I could have been there till today, and I missed this talk, because I wouldn't have gotten it out. Now, I look on the x-rays sometimes, and sometimes this is the flip side from men too, no offense.
the male dentist will think, I can do everything in this world, and that's not the case. I will look on a tooth structure, like I had a patient today, and I was supposed to take out his teeth. And I looked on the x-ray, and I looked on the x-ray, and I said, you know what? My dentist, who, although he's male, the only reason why I'm deferring to him is because he takes out more of those type of teeth more efficiently than I would. I know if I stayed in there, I would be like that man, 30 minutes, leave, take a drink, coconut water, come back, because I keep coconut water in my fridge, and come back and do it. But I realized that I want this person to be more comfortable and efficient when you're taking out the teeth. Because no offense, nobody wants to see them rocking the teeth to death in there. And even though you're numb, the whole idea of this man in your mouth for half an hour was a little daunting. So don't rule out the female dentist, sir. We are more inclined to look on something and say, we will send you somewhere. And we'll send you to another female, not necessarily man. But we'll send you somewhere where it will be taken out efficiently. So no offense, that gentleman didn't know what he was doing, and that's why he was in your mouth so long. And that can happen to you, because you will go into a situation and you realize it is really taking a lot longer than it should, and you pause. And that's why he left for half an hour. He left and looked back on the x-rays and said, oh, whatever I was trying, it wasn't working, so I'm coming back to redo it. So don't rule out the female dentist. And the flip side, and the funny thing, the flip side is persons come to me, sir, because they said that the men dentist is going to be rough. Oh, yeah. And the female going to be gentle. So they come to me because and then the flip side is the same dentist that I work with, he's very gentle. Not a small guy either. So when you look on him and him come into the room, you're going to be like, ooh. You can pull back a little bit. But he's very gentle. And you have these little small fellows that you say, oh, this gentle dentist is going to be dentist, very gentle. And when they come out, they're rough. So it's just technique and expertise. And yes, sir, that gentleman didn't know what he was doing. But you had a two-part question. The first part was a female dentist. What was the second part? See? We got... See, the female dentist, remember though?
What I want to do, because I floss, I brush 3 times, I floss at work, I floss at home, and I floss.
Oh.
Every time, it's so frustrating. Every time I go to want to do deep clean, I'm like, again, I mean,
well,
they give me the part, they give me the thing to goggle with, to do this, but every time I want to do deep cleaning, and
so I don't know if you were in here before when I tell you, if you think something is not right, sir, go to another dentist. Here's why you need deep cleaning. You need deep cleaning because you have gum disease. There are 3 factors of gum disease. You have lost bone around your teeth, okay? That's one. So when they look on the x-ray, they'll see bone loss. And it is getting worse and worse, in spite of what you did. That's one. Now, there's a space between, I'm going to put the thing on just for a little bit. This is your teeth, and this is your gum. There's a space between your tooth and your gums that we measure. It's supposed to be 1 to 3 millimeters. That's normal. If they measure it and it is going to 4 and 5 and 6, that's another sign of gum disease. When you brush your teeth, it's not supposed to bleed. And when I clean your teeth, well, no, the hygienist cleans your teeth, it's not supposed to bleed. So it means that the gums are unhealthy. So any of those 3 factors is there. But remember, and you all know, every profession have somebody that is not so reputable. Let's just be honest. You have the person who you go to just buy something from the car mart place and he want to take all your money. And so everybody have a profession. Somebody in the profession is not as honest. If you doubt that you have the gum disease, go and get another opinion. Invariably, patients, you only need, so you're supposed to get the deep cleaning, and then you have maintenance visit. If you are brushing and flossing and you don't have any of those issues, and ask them, why do I need to get the deep cleaning? If they're not telling you those 3 factors, sir, you have bone loss, you have bleeding when we probe your teeth, we see inflammation on the gums, meaning it's puffy and red. If they can't answer those 3, then sir, take up your bed and walk. Because this is how it is. And I'll be honest, sir, everybody, it is not good, and I'm not going to malign my colleagues, but I know the reality is that there are some doctors and dentists and professionals that are not above board, and there are some that are. But the bottom line, you should all take away. If you have a doubt, you have the opportunity to go to another dentist and say, hey, can I get a second opinion? Because they're there. So you don't sit there, sir, and wait. Now, some of these hygienists are very cute, and you will stay there. Okay, so the man roll him eyes, I catch him. And you will stay there, and the lady keep telling you need to deep clean it. No. You only need to get a deep cleaning and then maintenance. It's like if you lose weight. If you have to lose weight, the first thing they tell you is that you should do maintenance. Because if you don't do maintenance, you're going to put on back the weight. It's the same idea. Now, if you clean the teeth this year, and then 2 years later you haven't gone back to the dentist in those 2 years, then chances are you're going to get the gum disease again. Because it doesn't go away. When you have the gum disease, it's the fact that you want to maintain it. So, sir, if you've had it and you're taking care of it and you have concerns, ask them, why do I need to get a deep cleaning? And if they can't give you concrete answers, then tell them, c'est la vie, and go somewhere else. Yes, ma'am.
Question.
Yes, ma'am.
My son, when he was 8, he had to have dental surgery in the hospital where they call it it's when the teeth is soft or sensitive or something like that. And they said that he had that condition developed because when I was pregnant or something. I don't know, but it was really sensitive, like if he was to eat, drink water, whatever. But they put a crown, a silver crown on the back, 4 of his teeth, and he was 8. He just went to the dentist the other day, last week, and they were like,
How old is he now?
He's 13.
Okay.
So now they're like in the office, oh, we need to remove the crowns because they did the x-rays, and they could see like is it the molars? The other teeth, they can't grow past, they're like growing, but because the crowns are there, they can't come up, they can't grow past where it's supposed to because the crowns are like, they're like right underneath there. They're like growing that way, but they can't get up above the gum.
So what are they recommending to you?
They wanted to remove them in the office, and I was like, no.
Okay, so let's back up to when he was 8. If at 8 he had what you call is fluorosis, meaning that for it to be soft, you didn't have enough fluoride in. It's no fault of yours. In development, he didn't get enough fluoride. Okay. So it means then that, so some persons who have that, their teeth are, instead of just being one even color, you see it has white patches. So those white patches are areas where you don't have enough fluoride in it. The downfall of that is that that hard enamel that I said you should have, it's not there, and so you don't have that protection. So it is susceptible to the acid that we produce from our food. Okay. So if he was 8, to put the crowns on those teeth, those were his 6-year molars. No, if he's 8, right. So it was to put the crowns on, and then at about a year or 2 years later, they would take off the crown, not take out the tooth. So, and then after, if he's 13 now, then he should be getting his 12-year molars and so forth and so on. So unless I see an x-ray, the only thing I can think of is, and you can't take out those teeth because you need those 6-year molars because you need them to chew. So it must mean that the 12-year molars are not coming in, but they're not coming in and it has nothing to do with the crown because those teeth he got at 8 is not the ones like this lady who asked me about the double teeth. Oh, she left. Where your teeth, you have the double row of teeth, where your baby, the adult teeth didn't push out the baby teeth. Those molars at 8, those you need, so you can't take out those. So unless I see an x-ray, I can't figure out why they would want to take out the 6-year molars for the 12-year.
You want to take out the crown?
No, they take out the crown. Oh, the crown. I thought you meant the tooth. I'm sorry. Thank
No,
you.
they want to take off the crown
No, you
because
have-
it's stopping the other teeth from growing up.
No, that's what I mean. I'm sorry. That's where I got confused.
Okay.
You have to take off the crown because remember, the reason why they placed the crown on was to protect the teeth because it was too soft and it was too sensitive. So taking off the crown should have happened some years ago because the whole idea, whatever purpose it was to protect it, that has gone. So you can take it off and do that. But in terms of it preventing the other teeth from coming up, I don't understand. But yeah, if you had that silver crown placed, then you have to take them off by a certain time. And usually by now, you should have to take the crown off. They should have come off about at age 11 or so. They should have taken off the crown. Because what happens also is that bacteria can get around the crown. And if you don't do that, then you find that when he's like 16 or so, then he'll really have pain because the bacteria has gotten around the crown and have just eaten away at the tooth structure. And when they take the crown on, there's nothing there but mush. So that should have been taken off. The crowns should have been taken off some years ago. And that's why they need to take it off, because the purpose, it's not serving any purpose anymore. The purpose it was there to help with the sensitivity, that has gone. But it is just to protect the teeth that are there. And he must have had, so did he have, when he was 8 and he got his anterior teeth, his front teeth, did you see any white spots on it? So I would let them take the crowns off, because remember, you're not taking out the teeth. Thanks for correcting that. You're not taking out the teeth. You're just taking off the crown. And it's a good time to take it off because, no offense, we want our kids to brush their teeth as properly as they should, but you know they're not in there. And the crowns, plaque and all of that gather around crowns a lot faster than your natural teeth. So you're actually protecting the teeth if you take it off.
What does that have to do with the wisdom teeth now?
Not the wisdom teeth. It's probably, so I think what is happening now is that his 12-year molars are having an issue.
Okay.
So they want him to go in now to see if they can, at this point, put braces on to urge them out. Because you're supposed to have your 12-year molars by 12. So if you're 13 and they're not all the way out yet, we have to kind of urge them out of the gums. Because you don't want them to stay in the gums and totally develop. Because if they're totally developed, then you can't do anything about them. You can't pull them up out of the gums. Okay. And that's where the orthodontist comes in. Okay. So they'll put little brackets on it and wires, and over a period of time, slow period of time, they ease the tooth out of the bone so that it's level with the other one. So I think it's two different things that are happening here. Okay. They want you to go to the orthodontist to pull out those 12-year molars, which chances are 13 is not up as it should be. And they want to take off the crowns off the 6-year molars because they should have come off about 2 years ago.
Okay.
No, well, it depends on how fearful your son is, because they're going to have to numb him. At 8, they just knocked him out because it was just easier to manage him. But remember, at 13, you probably went to a pediatric dentist, and they'll give him at 13, they'll give him something mild. They'll just give him something maybe to drink and give him some nitrous and make him sleepy for them. They'll numb him and just take the crown off, and you're good to go. But it won't be as deep as when he was 8. It's just to calm his nerve and make him not be as apprehensive when they're taking it off. Know what? The problem is that is where you're playing you're flipping the coin, because you are hoping that whatever the protection that they did has worked, but the thing is you can't keep that crown on because it's a silver crown. That silver crown is not like the regular crown that you put on as an adult. It's thin, and it was only there as a protection. And because it's thin, the bacteria can get underneath there. But if it has if they see any cavities on there, they'll fill that area in, because at 13, he's too young to get an adult crown. You have to be a certain age, because he still has a lot of development. He still has a lot of face to fill in, height to put on. So you don't have a tendency not to put in adult crowns at his age. So if they take it off and they see areas where they where it might have sensitivity, they'll just fill that in with some filling material, and he'll be good to go.
Yes, I saw like a grown person.
Oh, yeah, yeah.
With their teeth are so closely impact. It seems like they have a double row. Is something wrong with why the teeth are like that?
Well, first of all, you threw me off with the brown person.
Huh?
You threw me off with the coloring part. You said the brown person.
No, a grown person.
No. Dr. Nelson had a long day, and obviously she's not hearing things. She's hearing things, but she's getting a little older than she said. It depends on, when you say they're tied together, are they small teeth? It looks very short?
No, they are of good size, but they are so close together, like they're overlapping.
Well, no, that is what we were saying before. When they should have had the changeover from baby to adult, the baby teeth stayed in there too long, and the adult teeth took up a position that it shouldn't. So that is why they get that double overlap. So in that case, it's not normal, and they should go to the orthodontist to get it straightened out. But it happens because the baby teeth didn't leave or come out as early as they should have.
I just want to thank you for your responses to these thought-provoking questions. But I have 2 questions for you.
Yes, sir.
Number 1, is root canal something that you recommend? And number 2, outside of yourself, how do you know a good dentist?
Oh, well, I like that compliment, sir. Outside of me, I will take that compliment. Thank you very much. I recommend a root canal because any teeth that we can hold on to is good because it's still part of your natural tooth structure. So if you have a hole in the tooth, we will recommend a root canal. But we can't recommend a root canal if we can't build up what's above the gums. So if you don't have enough tooth structure above your gums to hold a crown or something like that, then I don't recommend it. Because remember, the root canal is just treating the part of the tooth that's in the bone. But you still have to restore the portion that's above the gums, the one that's going to make you eat and whatever you want to do. So I recommend it all the time. But a lot of times patients will have issues with finance and they'll say, listen, just take it out and later on I will think about what will happen. And then later on, they have all of the shifting of the teeth and then they have to wear braces. So I always recommend, as long as there's sufficient tooth structure above the gums, to do a root canal. A good dentist will explain things to you in ways that you understand. You shouldn't come out of the room like this young lady over here with some confusion. You should have some clarity when you leave what is the next step and why you're going to have the next step. They should have, even if they don't have it, their staff should have enough support staff where it is explained to you what you need to have done. It should be gentle. They should be gentle. They should be gentle, was the most part, and be able to explain things to you where you can understand and you know how to make a decision. And then you'll trust them more to guide them where they want to go. If you have doubts like this gentleman who said, why do I need a deep cleaning every 6 months or whenever I go? Then, and you have that, everybody have that intuition that whether it's the Lord talking to you or whatever it is, you have that intuition where you say, this don't sound right. So if you have that thought, then you can find another dentist that will say, this is what, and if they can explain it to you and you understand what they're saying, and they can show you, because we have x-rays now, we have camera, we have a lot of stuff. If you can show it to you and explain it to you where you understand, and we're not going to use the big dental terms that we learn in dental school because then you really won't understand. But if they can not make you feel dumb, but explain it to you in everyday language, that is what you need to have done. So somebody who you can understand what they've said to you, they're gentle, and you don't have doubts about what the treatment plan that they're suggesting to you.
Hi,
I recognize you.
Malene. Okay, this is my dentist.
Yes.
And she's highly recommended. I have a question about filling.
Okay.
What is the main purpose of having a filling and how long do they last?
Okay. So the filling is a hole that you have in your teeth. So it starts off with just in being in the first layer. Stage 1 is being in the enamel. And then it goes to the next level. And then when it goes into the nerve is when you need the root canal that the gentleman is talking about. So the idea to do a filling is to prevent it from going towards the root canal. Because over a period of time, and everybody is different. You can have you, sir, can have a tooth that have the same size today. And 1 year later, it has just inched down a little bit. And this lady over here, same size, 6 months later, hers look like a crater. So the whole idea is to prevent the filling to get into that stage. A filling is easier for both you and the dentist, and it is cheaper because when you have to do the root canal, it is more involved, and after you do the root canal, you have to put a crown on it. A filling, you put it in there. No, how long it lasts, that is dependent on you. Remember, the reason why you needed that filling in the first place is because your tooth got damaged. And your tooth, there's nothing that we can make that is as strong as the natural stuff. We try, but we're not getting to get the filling material that is as strong as what you have naturally. So if you don't brush and floss, the same decay will develop underneath the filling. Now that being said, the silver filling that everybody dislikes is stronger in the sense that, not because of what the material is made up of, but how we treat it. The silver filling is a workhorse. You don't treat it right, and it's staying in your mouth for years. How much of us have silver filling in our ears from we in Jamaica, how long, and it's still there going strong? And if I try and go in there and take out that silver filling, pure worries are going to make on you. So like some of those silver fillings, if the size, we don't even go in that silver filling anymore. If we see it breaking down, we tell put a crown on it because the silver fillings are workhorse. The tooth-colored fillings are a little bit of a diva. They have to be flossed, very regularly brushed. You can't eat certain food, you can't eat all of that. So you have to take care of them. So the silver filling is a workhorse. You can treat it any which way it go, and it still lasts. The tooth-colored one, a little bit of a diva. You have to take care of it. You have to floss, brush, do all the things that you should do. So it depends, my dear, on how you treat it. Sometimes I use silver filling still, because if you have that teeth that you have way in the back that I know you can't get to, and nobody can see that until they turn you upside down, I'm sorry, I'm putting a silver filling back there because it will last longer. And who is going to see that silver filling back there except me and the hygienist? You can't even see it. So there's some, and they have this thing about it have mercury in it. If you eat fish, and I know everybody in here eat fish, you have some degree of mercury in your fish. So don't worry about that. And so it is not, if we were going to get cancer from those silver filling, we would all have cancer now, because everybody have a silver filling in their mouth. More than one time. Any more questions?
Dr. Nelson.
Yes, ma'am. Yes, sir.
When a patient changes dentists, say for example, coming to your office, do the medical information from the previous dentist follow you, or do you request it, or?
The Florida state says that your record is theirs and yours. So if you're coming to our office, right, you have to ask your old dentist to send it to us. We can't request it. That's the difference with doctors. If you are switching from one doctor to the other, all them have to do is call over there and say, send your records over. Florida state says that the record is yours and the dentist. So you have to tell the dentist to send whatever they want over. The only way we can get it is if we've been called up by the courts, and then everybody have to send their records into the court for any reason. But that is how it works. So that's the difference. It's like malpractice. Dentists have to have malpractice insurance in Florida. Doctors don't. And chances of you getting knocked off by a doctor is a lot bigger than us. But we have to have malpractice insurance before we can renew our license every 2 years. And the GP, medical doctor, don't have to do it. So there's a lot of nuances that are associated with the dentistry in Florida and other states that the other medical professionals don't have. So to answer your question, if you're moving from one dentist to the other, you have to tell that dentist, I need my x-rays, I need my whatever, and you send it to the other dentist. If we call the other office, we can call them and ask them, do you have recent x-rays on them? And only after we have something in writing from the patient that says we can ask for it, that we can ask for it. And even then, we're kind of slipping through the cracks. There's a fine line we're doing going against the legalities there.
Do you practice pediatric dentistry in your office?
I do. I see kids at 7. But there's a special heart that the pediatric dentists have, and I don't have. I can treat them because I'm gentle, but when I realize that the patient, the kid needs somebody who can calm them down a lot easier, I'm not going to put them through trying to suffer with Dr. Nelson. I try to make joke and make funny things. And after a while, they just look at me like, I don't think so. And they're not responding to me. So when that happens, I recommend that they go to the pediatric dentist. But I do start seeing them at 7. And some of the 7-year-olds will sit and listen to my very silly jokes and find it funny. And I can calm them down and work with them. But sometimes they are so nervous. Like I had a little girl who fell and she's 8 and broke her teeth. And as soon as I come in and look at me, she started crying. I said, okay, if I'm just in the room. So I took off my gown, she cried even more. But maybe it's what she saw underneath that she was crying about. Maybe, I don't know. But so I just sent her to the pediatric dentist. And she went the next day and they gave her the necessary sedation. And her mother sent back a picture of her teeth nicely done. And she was happy that I sent her daughter somewhere where they took care of her. Because I could have done the same work, but I would have traumatized her. I'd have to have her in a headlock. And no. They have gone 2 years extra dental school just to treat the kids. And there's a special love that they have that they can do very well.
Okay, thank you.
Yes, any more questions?
Okay, well, it was good talking to you and getting the information in. I'm going to leave a few cards here. It has my email address, I think, on it. If you have certain questions, you can send it there and I can answer. But just a note to take home. If you are at a dentist that you don't understand what they've said to you and you have doubts, find another dentist that you can get more clarity on that point. Like the gentleman that was here, if you've had a deep cleaning in the past, you should only have one deep cleaning. But if you have regular visits, there's no necessary for that to do that. And just remember that 6-month visits, very important. Don't wait to get insurance to go to the dentist because a lot of dentists have in-house programs and everything that they can accommodate you. So don't wait to get the insurance because the insurance that is coming out now is not something that you need to wait on. It's getting worse. The benefits are a lot worse. I wish you all God's richest blessings.
I know, just one last thing. I know that you are in the community, in this community. Do you do emergency treating in your office?
If I do emergency what?
Like cases.
Well, yeah, patients will come in and they have pain and all of that, so I will treat them accordingly. Sometimes I can work on them when they come in. Sometimes I have to give them antibiotics. Sometimes I have to refer them out. So we have, like the dentist that shares the office with me, some of the teeth, when I look on it, he'll look at me and say, whoa, no. You need to send that out to the specialist. So I do treat emergency patients. I don't live in Broad, so I can't, if you call me at 10 o'clock, I'm not coming to my office from Palm Beach to see you. I'm going to tell you that I'll see you in the morning at 8, but I'm sorry.
Thank you very much, Dr. Nelson, for coming in after a hard day's work. Thank you so much. Thank you.
Bye. Have a good weekend and everything.
And yes. Yes. Thank you. Thank you. So I'll have Sister Austin close out the AY program, and thank you so much for staying back. Thank you. I'm sorry.
If we have insurance in office? Yes. Okay, I'm going to close while the dentist is speaking to the young lady, but I'd like to thank you so much for coming to AY, and but I appreciate you staying, and thank you so much for coming out. I'm sure Dr. Nelson, she appreciated the questions. She appreciated you staying behind to be here with her. We will have ask Elder to just pray and close us out. Elder, you're going to pray to close us out. Thank you. And then announcements.
Can we stand for prayer, please? Let's pray. Father in heaven, we thank you for another blessed Sabbath day. We thank you for all you have done for us today, Lord. We pray as we go home, we separate one from another, that your spirit may go with us, oh God, and help us to have a wonderful week. Keep us safe and help us to be more like you. In Jesus' name I pray. Amen. Just one announcement. M&M Mission will be here next Sabbath. So please come out to AY and support the mission.
M&M will be here. We are reminding everyone of International Day and Youth Emphasis Weekend at the end of the month. We're also reminding everyone that South Florida Youth Federation will be here on July 7th for AY Takeover. The 7th of July, AY Takeover by South Florida Youth Federation. The 28th of June, we will be having our first Friday night AY. So everyone is invited to come out for the first Friday night AY on the 28th of June. So Friday night, we started at 8, AY. Thank you. Have a good night. Have a blessed week. Thanks for coming.